Hello.
Hello.
My name is Hannah Capra. Welcome to the panel for the grant opportunities for any facilities. I'm currently a graduate student in the George Mason Forensic Science program. I'm honored to introduce the following speakers. Dr. Jennifer Love is a physical scientist in the Office of Investigative and Forensic Sciences at the U.S. Department of Justice's National Institute of Justice. She manages the NIJ Forensic Technology Center of Excellence program and is the contact officer representative for NAMUS. Dr. Love is a board-certified forensic anthropologist and previously served as the vice president of the American Board of Forensic Anthropology. Before working with NIJ, Dr. Love was the forensic anthropologist for the DC Office of Chief Medical Examiner. Lucas Zarwell is the director of Office of Investigative and Forensic Sciences at the National Institute of Justice. He has also served as the chief toxicologist for the DC Office of Chief Medical Examiner. Mr. Zarwell has received certification as a diplomate of forensic toxicology from the American Board of Toxicologists and continues to act in this position. He is a member of the American Board of Toxicology and the Society of Forensic Toxicologists. Thurston Bryant is a special assistant to the director at the Bureau of Justice Assistance, U.S. Department of Justice. Dr. Margaret Warner is an injury epidemiologist at the Center for Disease Control and Prevention, National Center for Health Statistics, Division of Vital Statistics, Mortality Statistics Branch. Her research focuses on fatal drug overdose, suicide, and other sudden death. Dr. Warner received her doctorate from Johns Hopkins School of Public Health and studied injury epidemiology on a Fulbright Fellowship at the University of Otago in New Zealand.
Right, there we go. So everyone, hello. I am Lucas Zarwell. I am not Margie Warner. Margie is a juggernaut of public health and coroners and medical examiner system, but she was unable to make it today. And that's okay, because I hope that you guys can find her. She does come routinely to many professional meetings that deal with forensic science, medical examiners, and coroners because of the CDC's interest and importance. I think what I can say before I just kind of run through her slides is that NIJ and CDC have an MOU where we cooperate, share information, and even exchange funding so that and because of that, it's because we recognize the nexus of the importance of public health and criminal justice when it comes to medical examiners and coroners, right? Because, I mean, you guys have the data that provides the mortality information to the CDC so that we can make policy decisions that drive results, right? So whether that's COVID, whether that's gun violence, whether that's car accidents, I mean, these things, if we can get the data correctly, we can make more informed decisions about how to keep our nation safe. So it does matter. And then from a criminal justice perspective, we want to make sure that there's strong, reliable technologies, staffing, facilities, so that the work of not just, criminal, autopsies that would result in outcomes that might be used in a criminal trial, but also, natural death. Everyone deserves to have a death certificate with a cause and manner of death, because there are legal outcomes for that, whether it's a crime, right? So there's an nexus. So she has asked me to present, and I'm happy to do it. And I'm first to drive. So let me see how I do this. Is there a clicker, or should I just click? I'm good with either one.
Try the arrows.
Okay, perfect. Okay, so this year, CDC established this new office, and so it's called COMEC lovingly, but it's the Collaborating Offices of Medical Examiners and Coroners. They have a great website where they have fused together a tremendous amount of information about the coroner and medical examiner systems across the country, because CDC recognizes that it's a very diverse system with a lot of independent ways of doing medical legal death investigation. The real reason for this, and it was kind of the government's understanding and CDC's understanding, is that there needed to be a home for this. And so, the idea to strengthen the ties between the medical examiners, coroners, and the public health system to make sure that that's strong, to serve as a resource, which is another thing that they're working on. And of course, to assist public health researchers like epidemiologists and practitioners to engage with the MECs, because we know that epidemiology, the study of data, will help us develop better policies. So CBC is in front of that. So we know, like I mentioned, you guys provide critical data. You investigate deaths of high interest, including homicides, suicides, drug overdoses. Forgot to mention that earlier, right? Infant and of course occupational deaths. And now we've got issues with maternal health. There's a lot of things, suicides, right? Or maybe even like what we call it, lethal mean suicide. That's another term the federal government likes to talk about because access to weapons can increase the chances of lethal mean suicide, right? So these are things that we want to track. Often I'm first to encounter new health threats. We know this for sure because you guys are on the front lines. And so we're often seeing the impact of that. And of course, mass disasters, mass fatality events, COVID-19, and then address complex deaths with difficult to determine causes of death, right? So like when we have, you guys are medical examiners and coroners really have the ability to extrapolate based on all the information that they're given, the reason for a death that might be not understandable to the commonplace, right? And so one of those things we could just think about is I'm going to get this wrong. I'm going to say SIDS, which they don't use anymore. SUID, thank you. Look at how old I was when I was in the system. So SUID, right? So like it's a complex step. There's a lot of factors there that come into play. And unpacking that is a very important step. So these are the activities that CDC currently does. So they provide resources and training on their website. I'll show that in a minute. Services, they're serving to promote health and safety, assisting with streamlined data collection. That's a big one that NIJ has been working with them. They provide funding opportunities for medical examiners and coroners, and they conduct and fund relevant research. So the examples, of course, are trainings on drug overdose investigation, sudden unexpected infant death. Thank you, there it was. Disaster mortality, like what to do in cases of a mass disaster. We have a lot going on with climate change, so that's going to be larger and larger. The pathological or molecular evaluation of fixed tissues. So infectious etiologies, when we're looking at histology, what can we tell from tissue that we weren't able to see before? How can they train people what to do and what to look at? Health and safety guidance for potential exposure to COVID-19 and fentanyl. This is something we're interested in too, with working with NIJ. We have a lot of law enforcement in the field. They're awfully very concerned about the handling of toxic chemicals or illicit drugs, and making sure they understand whether there's actual limitations is important, because we don't want a first responder to not go into a scene because they're scared of fentanyl, when the reality is that that's not going to affect them on scene. Like fentanyl cannot be something that you walk into a place and you immediately get hit by fentanyl and get knocked out. It's not a weaponized drug, right? It has to be, you have to inject it, snort it, smoke it, that kind of thing. If you touch fentanyl, it's not going to go through the number of layers of your dermis and like go in and kill you, right? So these are things that we want to spread the news about so that people feel a little safe around that. Data moderation initiatives, CDC, the Forensic Technology Center of Excellence, which is NIJ's collaborative agreement with RTI. They run the Center of Excellence, and CDC partners with that. So one of the things we're doing is working with practitioners in order to develop, and I think Jen is going to expand on this a little bit, to develop best practices or ways to organize data which would be better exchanged with our public health partners and criminal justice partners. Of course, notice of funding opportunities. They have a way of doing that. I'm going to talk about that. And then public health law review of MEC enabling statutes. So that's something that they can look at, is model laws. This is on the website. You know, I can't click it because it's a presentation, but right. So what I was, it hated me. I didn't step on anything, did I?
Now it's like the screen.
Am I that boring? Hey Siri, wake up.
Main screen seems to have gone out.
What, yeah, I bet. Yeah, I got it. Is it back? Thank you. So anyway, they have this all nicely organized on their website. A lot of this look familiar, what I mentioned, disaster and preparedness, the National Violent Death Reporting System, different things on health and safety, like the handling of fentanyl, dangerous substances like that. Information about death certification, state medical examiner and coroner organizations, like whole lists of those. So they're really an aggregation of a lot of this information. So the way for funding opportunities, so CDC is interesting. They do monthly announcements, or COMEC does monthly announcements. So what Margie wanted to convey to you guys is to really sign up for the mailing by sending an email to MDI. It's a little bit underscaled right now, but if you send an email to mdi@cdc.gov, they can sign you up for these listservs, and then you get these monthly emails that literally spell out what they're doing month to month. Whether it's a training opportunity or an upcoming funding opportunity, they'll give you a link on where you can click on to apply. And there's a lot of times where you might want to comment on something. So for instance, the fire implementation, which I don't know if we're going into too much detail, but they'll want feedback from the public on something that they're putting together. There's the email, in case you can't see the smaller one, it's the bigger one, 3 letters. And so they use basically grants and cooperative agreements. So cooperative agreement is when the federal government partners with another entity or organization to accomplish the task. So for instance, CDC might partner with a medical examiner's office in order to implement a data sharing technology so that they're able to pilot that, see how effective it is, evaluate it, and then spread that technology further or make arguments to promulgate that technology. Make sense? Okay. So, or they're a direct grant, like, hey, you want to build technology, here's $1 million, please build it. That would be a direct grant. For those of you who have not applied, this is the way to apply for a grant for them. They have an index, but I think there's a lot of information that comes out of CDC, so it's important to filter that. So one of the things that Margie wanted to convey is when you go to grants.gov, you can select the opportunity status, funding instrument type, eligibility, and category. You want to make sure that you put a plus next to all departments of health and human services, and then select the boxes next to the 2 centers for disease control and prevention entries. That way you'll get warnings from grants.gov that are filtered to just CDC prevention activities. So if you haven't done that, many of us don't have individuals that we work with that handle grants for us. So a lot of this is kind of learning from the ground up. I can tell you, I had to do this as a toxicologist in a medical examiner's office. I had no prior grant experience. It just takes a little time and effort, maybe 20 minutes, half an hour here and there to figure out what to do. Grants are made to not necessarily, and if you get that experience, it goes a long way in your professional career, right? So now I manage a whole program that does grants, right? But it is something that is very, very important. And not a lot of people know how to do it, and it's not out of anyone's league. There's a lot of information online. A lot of people are very self-taught. And I encourage you to try to get involved and write grants and get feedback. So you can actually subscribe to the COMEC mailing list for the curated list of opportunities. So that's to this office, which is probably the most direct right, or you can sign up for grants.gov. You should be getting that information in both directions, but I personally think the COMEC sign up is probably the easiest. I think the grants.gov might be the most timely though. All right, that was it. Comments for questions? This is Margie's email. MDI@dc.gov. So you can see it's a small office because her email is the same as this is. And if you do have questions, send her an email. Lucas did a great job. And then you say, but I have this question, right? And see what it is. And I can try to answer anything you have about NIJ and CDC's relationship. Do you have any questions? Or did what I say make sense? Pretty much, fairly straightforward. Okay. Okay, so I'm gonna switch off. No, keep going. All right, fine. I always do what Dr. Love says. It's just easier.
It may be already open at the bottom.
Yeah, probably is, sir. Yes, thank you. It's open 4 times, right? No, there it is. Thank you. Okay. All right, so now I'm going to talk about something I'm more familiar with, which is NIJ's Forensic Science Research and Development Program. So these are grant opportunities, if you get some idea about what we are. And I want to talk a little bit about this. So I'm going to give you an overview of the National Institute of Justice. I'm going to kind of walk through who we are, what we do, how you can get involved and connect. Because a lot of people, you hear our name, National Institute of Justice, and you're not so sure what that is. So this will help too, because Thurston's going to talk, and he's equally important, not necessarily equally, maybe even more important when it comes to direct assistance, but he'll talk more about that. So NIJ is basically DOJ's think tank, right? So we do a lot of work. Most of the work we do is extramural funding of research and development awards. It's our regulatory charge. It's like why we were invented. We actually have a presidential appointee that leads and directs us, right? So it's a very small agency, about 70 people. And we do all sorts of work related to criminal justice. So that includes forensic science, technology, medical examiners, coroners, but it also includes a lot of social science work. You know, we really want to know programs that work, programs that help prisons, programs that help people that have spent time in jail, law enforcement techniques that might be better. Like how do we do major social science research out there to improve the criminal justice system? Okay, so that's what NIJ tries to do. How do we do this? Well, we do this listen, learn, and inform type of approach. So one of the things we're very good at is listening to the practitioners and the public and researchers about what the needs are of the field. We just don't assume those needs. We don't go to the literature and say, well, we think you need this. We go to where it's at and we say, well, we can tell based on our interviewing and our meetings and our working groups with all these practitioners what the criminal justice field needs. Then we solicit for research. We get results back, or the world or the nation gets the results back, right? And then we disseminate that information back out to the public. And by doing that, we're creating this cycle of, you know, seeing what works, using technologies or creating technologies that work, seeing if they implement, you know, where do things go wrong? How can we do better? Let's research that. And then it goes disseminate that information that we learned from the research and then recycle. So we have one thing that we like to do, though, is also we try to lead and participate in collaborative efforts. So we are a leading federal agency for facilitating forensic science research and development. NIST is also a large agency that does this. NSF actually does research in forensic science as well. And we partner with National Science Foundation, as well as we actually fund NIST in a lot of ways to do research. They have a different way of operating than NIJ. And so our main goal in forensic science is just to improve the quality and the practice of forensic science. That's really what we want to do. We want to do that through research, development, and evaluation and testing, right? And that's important because all those things take a long time for adoption. If you can think about what's going on right now with forensic genetic genealogy, that didn't just evolve out of anywhere. There was a lot of work done in DNA research to improve DNA and the sensitivity in DNA and the way they do DNA in order to create those kind of parallel sequences to do forensic genetic genealogy. So just a fascinating building of structure. So here's a QR code if you want to snap it. We have a research plan, which has 5 strategic priorities and 23 objectives. And it's really fit to NIJ's mission. It's a PDF. You know, it's very broad, and that was intentional because what we really wanted to do was we had to show a national position on research because we get so many interesting ideas and we know where we're headed because of things like the PCAST report and the NAS report and the demands on society and the demands in the criminal justice system. We have a unique view of where the work needs to go to improve forensic science. And so we think we've done that in this plan. And now what we're doing is, as we're making activities and awards, we're measuring them against this plan. It's kind of, it seems a little of an interesting way to do it, but that's how we want to show gains until we do a new plan in 2027. And it's very difficult to do. We have very limited resources, but you got to have a plan. Speaking of that plan, because we have a plan, we've also asked the president for more funding. And so we probably won't see this from Congress because of Congress. So the point is that this is the first time the president actually ever asked for anything for us, which is really great. So I'm proud of that. And we asked for 15 million, which is, I would be honest, it's a good ask, including $5 million to look at novel psychoactive substances. We know that there's emerging threats all the time, and we really wanted to focus on ways to capture that, so we could provide information to the medical examiners and coroners as quickly as possible about what might be emerging in the field. And then we also, interesting, NIJ kind of runs, we are all under a larger conglomerate, and that conglomerate gets a percent of all criminal justice funding. So there's capacity grants out there to help, hire more police officers and provide training, basic training. So a percentage of that can go to research. And so if we can ask Congress for an increase in the percentage of what we get from that giant lump, we can increase our own budget. We probably won't see that either, but that's okay. You got to ask, right? So you can see our funding is for research has dropped. This is not something that, we're doing our best. I think the NIJ director is doing their best too. But it's been difficult. Some of this is a result of moving capacity programs over to BJA. But the other part of this, I think, is just generally the giant eye that was looking at forensic science has kind of looked in a different direction at the moment. And so, we would like that eye back at some point, but it's difficult. There's a lot of needs out there in the criminal justice field, and forensic science, it will come back. And that's why we're asking questions, because we know the needs haven't changed. So this is how we ask for money. We actually have these annual solicitations. They're up on NIJ.gov, and we have a number of them. This is the broadest solicitation we have, and it addresses research and development in all the disciplines of forensic science, including death investigation. And so academics will put in research proposals, and sometimes laboratories or individuals will put in research proposals. And they get peer reviewed, not by us, but by people we ask to come in, subject matter experts from the field, to tell us, is this a good project? Should we fund this? And it's usually a mixture of researchers and practitioners. We're really looking for practitioner input, because whatever we want to fund, we want to make sure that it becomes applicable. And so if you heard earlier, there was a discussion about CT scanning. That's something that progenited out of NIJ's work. Like the evaluation of CT scanning is something that we funded to see if it was adoptable or transferable or usable. So that's just one example. The funding has, of course, decreased, but you can see that we actually get about, at one point in 2018, we're getting about 210 applications a year for research. We're able to fund about 27%. That's not bad. Actually, for research, I think NSF has about a 25% success rate. And so we've been pretty happy with what we've been able to do. It's recently dropped, though, in recent years, 21 and 22, it's dropped to about 15.3%. We don't like to see that. The reason we don't want to see that is because it becomes more competitive of a program, less people apply. So we want to make sure that we have enough money in this program to meet the demand of the 150 applications we get. Just kind of getting some idea here. This is about where the money goes. You can see, of course, there's a lot of money that tends to go towards DNA and forensic biology. It's very huge. Part of that's because a lot of funding that gets funneled into OJP from Congress is related to DNA backlogs. And so there is a higher focus on DNA than there are the other forensic disciplines. You can see that, pathology, though, MDI and anthropology get about 18% of the pie, which is not small. That's a pretty good amount of funding. So that should make you guys feel a little bit more interested in applying, I'm hoping. So anyway, the other thing is publicly funded forensic laboratories is our second solicitation. This is a much smaller solicitation. but it's actually kind of steered more for this audience because what it is it's a way that academics can partner with forensic organizations or what we call public labs. And so in order to be successful in this grant program, you have to make sure that you partner with a public laboratory or medical examiner coroner's office in order to accomplish the research you want. So let's say, just as an example, let's say George Mason University partners with the Virginia Medical Examiner's Office, and they want to do a study of X, right? So they submit that, gets peer reviewed, and perhaps we get a publication out of it, or a project out of it. You can see it's a much smaller program. In 2022, we only got 11 applications, and we only made 4 awards, but it's a higher success rate. And part of the reason was because NIJ knows that this is a way to get technology like immediately into a lab, right? If the lab is doing the work, learning the research with an academic institution, we're going to be rolling that out a lot faster. And also the same kind of pie chart, which we love to use here, only about 5% is MDI anthropology. And I think part of the reason for this is, human subjects are not really a concern because they're deceased, right? So we don't have that issue. But I think it's difficult to do research from a medical examiner perspective. And I think that's just, it's hard because it's not always, I think you're dealing with families, you're dealing with autopsies, you're dealing with human remains, and there seems to be people are very cautious and respectful around the subject matter that's being analyzed. So I think that there's a tendency to find projects that it's more difficult to do certain projects, but they can still be done. Okay. Lastly, we have the Graduate Research Fellowship. This is an annual solicitation. We do get a lot of STEM in here, but this is a great way to fund graduate students. So one of the things that we've had a hiatus on this program for a couple of years, but it's back. And it's a really great way. I think we fund about 30 to 40 of these on average when we do run this program. So it's a great way to get the idea for NIJ is to get young PIs or principal investigators involved in research, forensic science research upfront, so that they will continue to do that throughout their lives. Because we know if we want new thoughts, new approaches, better communities doing this research that's so reflective on society, we want to make sure that we're bringing people up from the very start, that they're getting involved in criminal justice, that they're getting involved in forensic science at the start, and then they're going into laboratories with these research principles, right? With a culture of research and a culture of objective thinking. And they're going into forensic labs, they're going into medical schools, and they are adding to the body of knowledge and continuing to strengthen science as they go. And so it's a great program. I just gotta think what I could say is over the years, it's been fairly successful in terms of the number of awards. But over 66 institutions since 2012. I will have an updated slide next year, so I'm excited about that. Last few things. So NIJ.gov is an extremely great resource. If you haven't been there, go. We have, this is an example of the forensic pathology website. So it'll start with like a splash page, give a little summary, but then underneath it, we tag almost everything we do. So there's a summary of some of the more recent articles, events and trainings, awards and other things that are related to forensic pathology right on that site. So it's a great way to kind of encompass whatever you're looking for. To give you an example of some of the research that we've funded, I mentioned the CT scanning. This was done with the University of New Mexico. It was almost $1 million award, well, $750,000 back in 2016. A very successful award that ended up in a tool that I think a lot of people still use for education and for reference. A couple other studies just to show you what people have done. This is another database that was created based on injury, the measurement of injury. So I think this particular university does a lot of work with collecting radiographic and histological data, but they actually have a bioengineering lab where they can impact, or like you can put a femur and like drop a rock on it. It's not just a rock. It's a weighted, precise device. and then actually measure the damage. So if you saw the skull fractures earlier, fracturing a skull is something that this group could do to demonstrate and to demonstrate how much force it would take to make that bone break in a certain way, right? So that's important for a pathologist because they don't have a reference for that, right? And if they go here, they might be able to say, oh, that's an interesting fracture pattern. Let me see if this database might have some injury descriptions about what causes that. And this is another one. This is a GIS application. This is relatively new. It's still in the works, but this is a crowdsource database, which is an application for medical legal forensic cases and human decomposition research facilities. So I think the idea was there's always been a need from the community for PMI. That's our understanding from our postmortem interval studies. It's very, very important, especially in the Southwest and areas where you see you might find a body is completely skeletonized or somewhat skeletonized, and identifying about when that person died is a very big question. It's a little less important in urban areas because we just, we fall over you often when we're in urban areas because the people die, someone knows you, you're in the building next door. We haven't seen so-and-so for a couple of days, but if you're out in the desert and it's someone who crossed the border and you don't know how long they've been laying there, right? So the PMI is pretty important. So we're hoping that this kind of database might help inform that information. Now to the meat and potatoes of it all. NIJ is really easy to connect with. You can subscribe. We have a subscribe button literally on the top of the page. And you can hook up and click on the word forensics and it will send you all the forensics releases that we have. The new NIJ director, well, she's not new anymore. She's been there for a couple of years. Dr. Nancy Levine is very supportive of forensics. She was at ICME this year to just deliver NIJ's commitment to the medical legal death investigation community. And she did a video for AFS. So she's assured me that she's very supportive, and it's showing in the way that she's making her funding decisions. Oops. And then finally, for solicitations and other projects, you can scan here to get a link to the site. I think is where it goes. I can't remember. But yes, so just so you know, you can actually look at current solicitations that we have posted, our prior solicitations, our awards are all up online. Everything is transparent. It's easy to find. It's easy to reference. You can search for topics and all that will come up. And of course, our forthcoming opportunities page will launch when we have a new solicitation that comes out. So if you stay informed, stay linked up, you will get those releases in your inbox. I think it's always good if you're interested in applying for NIJ grants to look at the prior solicitations and read through them and start to ask questions with yourself or with the staff that you have or with your coworkers. Hey, could we do this? How are we involved? Do we have an academic institution that we can partner with? Maybe they have a grant writer that's more experienced than me that can teach me how to do this. How can I get involved? And it's not that far away. And we definitely need this community to submit applications for peer review. So thanks. I will now go to somebody else. Any questions on this is just the R&D awards. Any questions? Either I'm doing a good job or you seem engaged. That's good. All right, great.
So how do I do that? Oh, might need your help. Yeah, this is. All right, folks. Hi, my name is Thurston Bryant. I'm happy to be with you guys this afternoon. Senior Policy Advisor at the Bureau of Justice Assistance. Started my career at OJP, so I've been at the component for about 23 years. So get a little bit long in the tooth. So I'm happy to be with you guys. So Lucas talked about some of the research-related grants, and NIJ is a sister agency, as we call, with my agency BJA. I'm going to talk about some of the site-based grants that are available to you guys. So I think we have like most of the same individuals who were in this session before when Danya spoke about NAMUS. So from my recollection, we have like, a lot of NBC offices represented here. We have some law enforcement, and then we also maybe have some prosecution offices, maybe? No? Okay. But we do have some students. And so I'm going to talk about a couple of the specific grant opportunities for NBC offices, but I also want to kind of like talk about too, there's like a lot of other resources available at OJP that you might not be aware of. So just our disclaimer, just saying like, anything I say is just my opinion only. So we're not going to hold the DOJ liable for that. So Lucas talked about a little bit about this before. So what is the Office of Justice Program? So how many of you guys, raise your hands, are familiar with OJP? Say so, it's so comfortable. Okay, great. So when you're thinking about grant opportunities within the Justice Department, think about there's three main pillars. There's the Office of Community Oriented Policing Services, which is the COPS office. So they provide grants and resources for community policing related efforts. The second is the Office on Violence Against Women, or OVW. And then the third one is OJP, the Office of Justice Programs that NIJ and BJA belong to. So of those three main pillars within, in terms of grant making components within the Justice Department, OJP is the largest. So OJP consists of 6 individual bureaus, which includes NIJ and BJA, but 6 individual bureaus that provide grant opportunities and training and technical resources throughout the entire criminal justice spectrum. So you'll see there, you see BJA, BGS, Bureau of Justice Statistics, so statistical reports, NIJ, Lucas, and Jen's team, OVC, Office for Victims of Crime, JJ, as we call it, Office of Juvenile Justice and Delinquency Prevention, so juvenile justice initiatives. And then the SMART office has like that long acronym, but it's basically sex offenders, tendency monitoring, and apprehension. So those are the 6 main bureaus within OJP. So BJ, we provide site-based grants, partnerships with states, local government agencies, tribal justice entities, as well as nonprofits, training and technical assistance resources, you name it, across the entire criminal justice spectrum. We're led by, similar to like what Lucas said, we have a presidential appointed director. That's Director Carlton Moore. He's from Ohio. He used to be the director of the state administrative agency, or the SAA, from Ohio. So he was appointed by President Biden in February of 2022, and he oversees our entire agency. So our agency is divided into like 4 different offices. I'm a part of the policy office. So what we do is we kind of develop and manage all the solicitations primarily. The programs office, they're like the experts on financial grant management on a day-to-day basis. We have our PSOB office, which provides death benefits for family members, surviving family members of fallen public safety officers, so law enforcement officials, firefighters, etc. Then we have our operations office, which includes like our communications team, as well as like our budget team and what we call like the front office for the director. So I'm going to talk about these 4 main funding opportunities, but I want to kind of, so I'm going to talk about the Paul Coverdale program, the Strengthening the Medical Examiner Coroner program, our Missing and Unidentified Persons program, and then our JAG program. But before I do that, I just want to kind of let you know that we provide funding across the entire criminal justice spectrum. So to give you an example, for this year, I think we might have administered over 60 individual solicitations or programs, just our office alone in BJA. So 60 programs, covering law enforcement, corrections, forensics, tribal justice, substance abuse, mental health, adjudication, whatever you can think of. So keep that in mind. So like if there's something that you're looking for that's not really specific to forensics, please go on our website, do a search. There's a lot of funding out there that you might not be aware of. So I'm going to talk about these 4 grant programs and then 2 training and technical assistance resources. So these are free. And so you'll see like with a lot of our robust programs or individual grant programs, we have a training and technical assistance provider for those individual programs. And so these are 2 that I just wanted to kind of mention that kind of like, fall in line with providing resources for NBC offices and NDI community. But I'm going to talk about these 4 grant programs up above. Now, the first 3, these are programs within our overall forensic unit. So, but our forensic unit also includes our National Sexual Assault Kit Initiative. We also have a program for prosecuting cold cases. We also have a program called SEBR, SEBR, which is Capacity Enhancement Backlog Reduction Program. And then we also have one that's focused on post-conviction testing. I'm just going to talk about these three in relation to the NEC offices. So this is like, some general information. So, what are the ways that NEC offices can receive funding directly? So, I often speak with like some of the, the NDI, the NEC associations, and this with some of you, at the state and local level. And what I hear sometimes is, hey, what can we do? Because sometimes our hands are a little bit tied because we have to apply through our jurisdiction, our mayor's office, our governor's office, our state administrative agency. But some of these programs, like the one I'm going to talk about, the Strengthening Medical Examiner Corner System program, there is no regulation or rule that you can't apply directly. So you can apply directly for that program. You don't have to go through, we don't require you to go through any, governor's office or whatever. If you meet the requirements of that specific program, such as the Strengthening the NEC program, you can apply for that directly. Also, wanted to kind of make note that if you're interested, like in our funding opportunities in general between like BJA and Lucas's team, it's good to kind of know like what the funding cycle is. So our overall DOJ funding cycle runs from October 1st to September 30th of every year. And so when we start to put out like funding opportunities like grants, things of that nature, that's typically done between January and June. And so the amount of time that those opportunities are available to the field, it could be anywhere from, 2 to 3 months. Typically, say 60 days is 2 months. So it's great to kind of be aware of when that occurs. Also, most of our programs, they're competitively based, but there are some that are formula based. So that will be like identified on the solicitation that you guys are interested in. And so I mentioned that you can apply directly for funding. And that overall the decision is just based on the entity and then the information that's located within that specific grant that you're interested in or that program that you're interested in. And then of course supplanting is now allowable. So the first program is the Paul Coverdell Forensic Improvement Grant Program or called Coverdell. So Lucas mentioned that there's been like a shift in terms of like the grant programs that NIJ manages and the ones that BJ does. So in 2020, the site-based forensic programs were transitioned from Lucas's team to NIJ to BJA. And so this is one of the programs. This program actually started up at NIJ years ago, back in 2002. And so this program is seeks to improve forensic science and NEC services for jurisdictions. And so one of the things that's important about this, as you'll see on the screen, is it's the only source of non-federal funding for all forensic science disciplines and NEC offices. And that it also provides, in terms of specific NEC offices, it provides funding to educate and train forensic pathologists, in addition to enhancing NBI systems. It also provides funding for accreditation and certification purposes. So the way this program is divided up, there's a formula-based program or formula-based aspect of it, which is awarded to the state administrative agency. So there's usually one state of SAA per state. And then the competitive portion of that includes states and units of local government. And so historically, there's been about $30 to $35 million in grant awards for the total program that are awarded each year. For these overall award amounts, I think for this year, it's been like the same for the last several years. I think the award amounts are up to $500,000 each award. So the next two programs are ones that I specifically manage. So our Strengthening the Medical Examiner Corner System program. So this program was started at NIJ back in 2017. And so what you'll find is like with a lot of the programs, there is a statutory congressional language that, that is used to actually authorize and fund the program. This program is actually does not have like its own individual statutory line item. It's actually funded from funding that we share with Lucas's team, but it was developed up at NIJ just based on the need from the field. And so what it does is we know that overall there is a huge dilemma with the number of board certified pathologists that kind of help do the work that all the NEC offices does. So there's two purpose areas to this program. The first one is purpose area 1 for fellowships. We provide funding for offices to enhance the number of board certified forensic pathologists. So we do that through fellowship positions. And so the award amounts for the fellows are $150,000 per fellow. So if you're accredited to do 2 fellows, you can do so. And so that would be an award for $300,000, so $150,000 per fellow. The other thing that we've done over the years is we will provide loan repayment. So we know about the expenses for being in the field to become, in this position, in this career field. So what we've done is we've tried to enhance and increase the number of loan repayment opportunities over the years. So for this year, $75,000 is available out of that $150,000 per fellow for loan repayments for individuals. The second category is for accreditation. So to maintain and acquire accreditation for NBC offices. Those awards are a little bit smaller, $100,000, but you can use that for equipment, what have you, as long as it pertains to that accreditation purpose area. So of course, the eligible applicants for this are NBC offices. And then funding levels, we've been able to fund this program at about a little over $2 million every year, and we've made about anywhere between 10 to 15 awards total for the program, which includes some for the fellowships and then some for the accreditation purposes as well. What we call our MER program. This is actually a new program that we started last year. So this is our Missing and Unidentified Human Remains program. So started last year, and so this program is well received from the field. Of course, we know from like the information that Donia provided earlier, the number of missing individuals that go missing every year, over 600,000 individuals. This program complements NAMUS and what she does with her team and with Lucas's team, because whereas NAMUS provides services on behalf of jurisdictions, this money provides grant funding directly to you, directly to the jurisdictions, to go to address the volume of missing and unidentified and human remains cases. So the purpose of the program is to establish and expand programs to improve reporting, transportation. The transportation aspect includes like repatriating loved ones' remains back to the family members, forensic testing, and an identification of missing persons and unidentified human remains in the United States. That includes migrants. So we have three purpose areas. The first one is for statewide agencies. Those awards amounts are for like up to $1 million each. The second category is for counties and use of local government. Those award amounts are for up to $500,000. And then the third purpose area is a little bit different. What we're looking for is one entity that can provide services on behalf of small rural and tribal agencies on a national level. So last year, we made 6 awards. At the state level, that was to Texas State University, Florida Department of Law Enforcement. And then at the county level, the local level, we made 3 awards. Riverside County in California, Miami-Dade County in Florida. Then the third one was to DeKalb County in Georgia. And then for this third purpose area, it was made to the University of North Texas Health Science Center, which is well known in the forensic community. And so with that one, especially the UNT award, we're working collaboratively with the Donia's group at NAMUS to provide services in triage and duplicate cases on a national level for small rural and tribal jurisdictions. So you'll see for the eligible applicants, I highlighted medical examiner offices. So the legislation for this program is pretty prescriptive in terms of who the eligible entities can be. Now it says medical examiner offices. It does not include coroner's offices, but a coroner's office or any other criminal justice agency could partner with one of these eligible applicants to provide services for their jurisdiction. And then for this year, we have a little bit over $5 million available. We actually had some additional money, so we're actually make more awards than that. Last year we made 6, so we're going to make more awards than that for this year's funding. So one of the things too that Lucas talked about, and I'll mention this a bit later, is that if you're interested in some of these programs, we've tried to make it as simple as possible for the field. So one thing that you'll see is you can go online. So like each of our forensic programs, if you just Google BJA forensics programs, there will be like infographic tabs for each of those programs. For example, once you get if you click on the one for the missing and unidentified human remains program, it'll have a sample application from last year that you can look at. So I have the program narrative. It might be slightly redacted, but there's a program narrative there. I think the one that we have online is from DeKalb County in Georgia, which includes like a partnership with the prosecution office. And then there's also one from Florida Department of Law Enforcement. So it's the program narrative. So it's about 15 pages, but it might be slightly redacted if there's like individual names in there. But you can go online, click on that, and with agreement from those partners, you can look at what their application was to give you an example of what a successful application might look like. The prior program I talked about, the Strengthening the Medical Examiner Corner System program, same thing. There's a sample application online from the state of Connecticut's medical examiner office. They've been very successful with their fellowship program. There's one for accreditation for the accreditation purpose area from Western Michigan University. So if you're interested in these programs, the first thing to keep in mind is the time frame when our applications are going to be open, January to June. And also take a look at some of these successful applications to kind of help you guys out. Now, I can tell you from the one for the strengthening the medical examiner corner system program that I manage, that program's not going to change that much from this year to next year. So what I recommend is, like, if you're interested in that, go online, look at the application from this year, take a look at that, digest that, and then take a look at the sample applications as well. The other thing to keep in mind too is that we provide a frequently asked question document for our programs. So for the missing persons program and then the MEC program, there's like a pretty lengthy FAQ document online. So any questions you might have might already be answered. If there's additional ones that you have questions about, I'm gonna leave my business card on my email address. Email me, because what I'll do is I'll take that information, those questions, integrate into the document coming up for this upcoming year, provide more resources for the field. So this is a program I want to make you guys aware of. It's not specific to like the NBI community or to NBC offices, but it's our JAG program. Have any of you guys heard of our Edward Burr Memorial JAG Assistance Program? Yeah? Oh, okay. Criminal justice funding. So as you'll see, this year's total funding, over $300 million. That's a combination of state and local funds. So JAG is a formula-based program. So there's a state formula allocation, and then there's one for localities. So the state money goes to the state administrative agency for each state. So for example, for Michigan, I think it's like the Michigan State Police. So that could be like, say, like $5 or $6 million. And so then what happens is the SAA for that state then decides how that money is going to be allocated throughout the state for different criminal justice resources. JAG funding, as you can see, can be used for all sorts of criminal justice purpose areas, law enforcement, correction, you name it. It can be used for pretty much anything except for, like, buying airplanes or, helicopters, but you can use it for equipment, supplies, personnel, law enforcement, equipment, things of that nature. You might even be able to use it for police cruisers. But I would take a look at that. Now, as an MEC office, you might not be able to apply directly for this funding. But what I suggest is that if you have a relationship with one of these entities, either the SAA for your state, or like at the local level, that might be like the mayor's office or some other, like, county level office. If you have a relationship with that entity, is great, because then you can say, look, Mayor, I want the MEC office, we need some equipment for our, for our office. So they might be able to, like, work with you to carve out some money for whatever criminal justice purpose area you need. But as you can see there, did I put that up there? Yeah, at the top. We've awarded over $7 billion in funding to the criminal justice community, to communities over the years for JAG funding. And so if you go online, just Google BJA JAG funding, there is actually like a PDF file for this year, and it'll tell you how much each state is getting at the state level. And there's also a document for the locality allocations. It'll tell you like how much each of those entities within the state, within your activity. So like, we're here in Virginia, Fairfax County, there might be like a certain amount, Prince William County where we're at now. All that information is publicly available online to take a look at. There's also like a lot of information online for JAG in terms of success stories, things of that nature. So definitely take a look at that. This is a very great resource to know about. And then you'll see like the amounts of the examples that we provided funding for this year. And this has been in existence since 2005. So. Now, this is something new that we developed. So I mentioned like how like a lot of our individual site-based programs, we have like a training and technical assistance provider for each. So last year, we actually made an award to RTI International for our forensic TTA program. So this is going to provide assistance to all the active forensic science site-based programs that we have at grantees. So we have over 500 active grantees, and that's growing every year. So this program will provide assistance to that. But once our website will be operational probably like within the next month. It provides assistance to our grantees, but all that information is going to be online. So that will consist of reports, lessons learned information, what have you, so that even though it's supporting our grantees, all that information is going to be online for you to take a look at. webinars, et cetera. So it kind of works in conjunction with some of the resources that Lucas and his team provide with some of the forensic centers that they have. But keep in mind that this is something that's going to become operational as well. There will also be success stories available online as well for that. So take a look at that. This is a more robust, more generalized training. Our BJ's National Training Technical Assistance Center. It's all free. So like if you have like a need for your agency, just contact NTAC. They also provide on-service demands. So depending upon what it is, it can be anything related to criminal justice, law enforcement, forensic, whatever. You get online, there's like a, I believe it's like a document, a request document you fill out. But then they will work with you, provide whatever services you need. It's all free of charge. Just a couple ways that we kind of make our resources available to the field. So I mentioned about our DOJ timeline. It's important to be aware of that. When our solicitations actually are released, we usually have within 2 weeks of that release, we have funding webinars. So like if you go back for the missing persons program and the stripping the medical exam in the corner system program, I conducted webinars this year. Those are all archived online. The webinar itself, the presentation, everything is online. So I would recommend if you're interested in applying for funding this upcoming year, go back and listen to those. Also, we provide overall agency webinars. So I mentioned that our timeframe starts in January to June for releasing our solicitation. So in January or February every year, usually BJ will have like an overall agency webinar. So we'll talk about all the programs that are going to be released that year. And so that's kind of a great opportunity to kind of like know what's coming out ahead. So it might be some of the ones that we've consistently released the prior year, but there might be some new ones as well based on demand from the field, et cetera. How to apply webinars. So we migrated to this new system called Just Grants about 2 years ago. It's kind of been kind of cumbersome, and some of you who apply for grants, you guys kind of know how difficult it's been. I see the gentleman right there. Yeah, hey, believe me, I know how that is as well. So we actually have how-to webinars. So we actually have one that we conducted this year. It's about an hour and a half long. It'll kind of give you the nuts, the bolts on how to apply from the beginning of the application process to the end. Plus, there's like other webinars from Just Grants team members on to kind of help you out with that process. And then also we provide webinars for specific stakeholders. So like, for example, if there's something that maybe you in the NDI community, you maybe want us to provide like a webinar specific for your association. We've done that in the past before to kind of let them be aware of like what's coming out regarding NEC offices. Some other ways that we make our opportunities aware, aware to deal with stakeholders, grantees, stakeholder conference attendance like this one. We have our BJ electronic newsletter similar to like what Lucas and his team does as well. And then information on the BJ website, and then we do congressional outreach as well. So like with our program, we don't lobby, we can't lobby for additional funding. That's where you guys can come in. But we do try to spread the word and work with our congressional partners, on awareness of our programs and things of that nature. So these are like a couple of things that's kind of wanted to make you aware of our overall BJ website. I think one of the best mechanisms to kind of become aware on funding opportunities come out is to get on the BJ website. On the homepage up in the upper right-hand corner, there is a subscribe link. Click on that, provide your email whenever funding opportunities come out. You'll get that notification. This is the link for our BJ forensics page. So if you click on this link, it'll take you to our main forensic page. And like I said, there'll be like information cards at the bottom. If you click on that, it'll take you to a specific program. For example, our missing persons program, there'll be like a lot of historical information, why the program matters, site map of the grantees that have been awarded, funding dollar amounts, success stories, you name it. Overall OJP grant funding resources. So this is similar to like the BJ main page. Go to this OJP grant funding resource at the top in the upper right-hand corner. You click on that subscribe button and provide your email. It'll provide you like with resources on funding opportunities throughout all of OJP. So my agency, Lucas's agency, NIJ, BJS, JJ, etc. Grants.gov is federal grant opportunities across the entire federal government, not just the Justice Department, so across the entire federal government. So that's very, I'm going there and search the subject area. Just grants, if you guys want to, get into like, all the details about our new funding system, Just Grants. And then this is also a very significant resource. It's changed over the years, but in years past, if you clicked on this Office of Justice Programs Award data, you could go search by your city, your congressional district, or your state. It'll pull up grants, active grants in your jurisdiction. In the past, you used to actually be able to like, I think, search by maybe criminal justice topic area, and then like having an abstract of the project in the dollar amounts. So that's a good thing to know because there's a lot of money out there that you might not be aware of. So then in that case, you can partner with entities who have those awards and form collaborative partnerships and maybe receive some net funding to assist your needs. Lastly, this is me. My email address, our email address is the Justice Department, pretty simple. First name dot last name at USDOJ.gov. That's me, Thurston Bryant. I have that business cards. My phone number's on here too, so feel free to ask me any questions you guys might have. I'll actually be at the this event tomorrow and Thursday as well. So if you see me around, please stop by, chat with me. Let's exchange cards and I can help you out. It might not be something specific in this MEC and DI area, but I've been at OJP for 23 years, so I can kind of help you kind of navigate your needs. So with that, if you have any questions, let me know. Otherwise, thank you guys for letting me join you today. Yes, sir.
The question regarding that JAG funding, you mentioned that in that big list, there was no specific call out for MECs, but you said we could partner with like the mayor's office or something like that.
Yeah,
How does
so
that work in the context? Our office needs new imaging modalities for the purpose of what we do. You can partner with the mayor and they can ask for it.
yeah, so I mean, it's a little bit tricky because like, each state, each jurisdiction is different. The reason I want to, quote the JAG program is because it's so much. It's something robust enough. Now, for example, when I spoke with some of these offices, like the state level, for example, they have like those relationships like with the SAA already, you know what I mean? So if they need like some equipment or whatever, they go ahead and kind of like, make that connection. For you at the local level, I would go online and see like, who that entity is for your county or whatever. And then if you're able to do that, just maybe just have that conversation, say, hey, you can't remember JAG funding, or maybe a possibility, or you could maybe help us out with some funding or whatever. It just works different for, for each state and locality. I would definitely take a look at it. Like I said, over $7 billion. That money is formula based. So every year that money's getting more. So like I said, you can go online and look at the PDF. It'll show like how much you're doing at the state level for your state, and then also at the county level as well.
And to add with those, and the state can kind of decide once they get that grant, how they want to use it. And so if you combine or you can target the state, the SAA in your, and understand who they are and who they are, those conversations can happen. Like I did that when I was with the government, the mayor's office had a separate agency that handled criminal justice awards and applied for grants, and so we had to apply to them. But there were other instances where people applied independently and money to them. So just need to understand how they know what they're doing. So just sometimes it's just making that connection.
Exactly. And if you're going to do that, we'll go ahead and start the process now because you know how it works. We're going to start having those conversations, kind of about how they utilize that money early on. They're not going to wait till like the spring of next year. They're already going to have things to have that plan in place to go ahead and do that. And then like if there's any additional information online, just send me an email. I can say that I can kind of move. Yeah, we might have some information online on how to kind of like then we and then one last thing, we also provide, we also have like internships.
Oh, very good. Thank you. So thank you all for having me this afternoon. My name is Jennifer Love and I am with NIJ. I'm in the same office as Lucas. I've been there since January of 22. Before that, my career was in the medical examiner's office. I worked in Memphis, Tennessee, Houston, Texas, Washington, DC, and in all those offices, I served as the forensic pathologist. So I know the ME system pretty well over the years. But now I'm working at NIJ, and we've heard all of our funding opportunities through Lucas, so I'm going a bit off script here. So rather than talking to you about some of the grant opportunities, I'm going to talk to you about some of the learning opportunities that NIJ could bring to you. So Lucas went into detail about some of our research grants that we have available to you, and some of the projects that have been funded. But so we have our research, our academic individuals that are doing this great research and creating great products to help us in the ME system, but we need to make that translation from the researcher to the practitioner. So NIJ has the Forensic Technology Center of Excellence that is focused on bringing that new innovative research to the practitioner and giving it to you in a way that allows you to start to use it and to implement it. So I'm going to talk today specifically about that program and what's available to you. So DOJ claims this is all me. It's not the federal government. So if I say something wrong, fingers are pointed here. So again, so NIJ, we are the research arm of the Department of Justice and give out research grants. One of our larger grants is actually for the Forensic Technology Center of Excellence, and it's a 5-year grant. So we give it out on a 5-year basis. And it creates a cooperative agreement. So we work directly with the grantee in an open conversation of how we want the research that we funded to come down to the practitioner. So we're working together to develop all of these learning opportunities. This grant was most recently awarded in 2021. So that started another 5-year cycle. And it was 2 awards was made through this most recent grant award. One to RTI in North Carolina, and the other one to Florida International University. Both are doing kind of 2 different projects within the grant that we'll look at more closely. So first of all, FIU. We at NIJ realized that really getting research and information to practitioners was important. And so through this grant, we've worked with Florida International University to create a library, a database that's focused on forensic science. So here's the website, forensiclibrary.org, that you can go to, and it allows you to search recent research. So when you go to the site, these are the categories that we have a forensic librarian that is collecting, recent publications as well as historic publications, categorizing it and making it available to you through this forensic library. So you can see all the areas that it's forensic science that is covered, but crime scene investigation and reconstruction, as well as forensic pathology and NBI. So you can go in and search any of these specific topics. Now, or you can search everything, which is the way because you'd be like, well, is that anthropology? Is that really whatever? You don't even have to think. Just go search everything, and it's going to search all 4,065 documents that are held within this database. And this is a continually growing number. So we have the forensic librarian is constantly adding new pieces of research as well as historic pieces to this library that you can search on. So the greatest thing about this library is that every article, every document that's included is open access. So when you go do your search and you click on autopsy, histology, and toxicological findings and death associated with new psychoactive substances, you may want to read that. You click on this link, you're going to the actual article, like you're getting the whole article. You're not ending up in a paywall that just gives you the abstract and you have to pay a fee to get the article. Everything that is included in this database will take you to the actual article so that you can read it. Okay, so very nice tool in order to really access what's out there in forensic science. Now, another thing that we have, it's under card catalog video. Let me ask you, how many of you have actually know what a card catalog is or have touched it? Okay. So for those of you who haven't, so our librarian may be my age, He may have used a card catalog. For those of you who don't know, back in the day, you walked into a library and you actually physically looked through little cards that printed all the title of the books. You got a number, it was the Dewey Decimal System. You walked through the library, you actually found the book. That's how we did it in the old days, called a card catalog. Now, probably in hindsight, we probably should have gone with a different term, but we used card catalog videos. So these are actually training videos that can kind of help you navigate the world of all of this literature that's out there in forensic science, okay? And so we're building these. Right now, we have 2 available. One is this research credible? And can somebody help me with my research review? So is this research credible? And actually, there's a new one that's about to hit the website, which is Predator publications. So there are publishers who publish work that's really not valid and not reliable, and it's out there. And you need, when you pull out an article and you're going to read through it, you need to know, am I reading something valuable? Am I reading something that's peer reviewed? Am I reading something respectable? Or am I reading junk science? Because we know not everything we read on the internet is true. So it was true in the card catalog, but not so much on the internet. So this is just a really nice, just an easy to watch video that kind of walks you through some of the key things you should be looking at when you're looking at literature to make sure that you're looking at something successful. Can someone help me with my research review? This just sort of points out some of the other, like PubMed and Medline, other areas where you can do research, gives you an idea how to put your keywords in so that you're getting a broader look at the literature. So just really interesting, easy to watch tutorials. They're YouTube, just a minute or two, but gives you some great information. So that they're coming online as we continue with this grant. There is also, if you choose to, you can get this daily digest, which every day, Monday through Friday, you will get an email that just has recent publications that have been added to the library. And they're organized by the different topics. I get them every day. I just scroll down to anthropology because that's what I'm most interested in, and look and say, hey, is this something I'm interested in reading? So if you choose to, you'll be able to see from the library site where you can subscribe and get this delivered every day. And it's interesting to see what's popping into the library. Finally, and yet most importantly, from the home site, you have the email. You can reach out to our librarian with your specific questions. So if you have a research question and that you're having trouble navigating, you're like, why can't I find anything, whatever, you can reach out to the librarian and the librarian will help you with your literature search. So you can get to a real life person, just like back in the days when we went to the library, and someone can help you. So I just want to, so this is one of the projects we're funding through the FTCOE, and I really think it's really sort of helping us fill a need of the field. Okay, so the other grant award that went out most recently went to RTI, and that is for our, it's also the Forensic Technology Center of Excellence, but it's more of a learning opportunity. So FTCOE, the RTI program, does a lot of learning opportunities that are very easy to digest. They provide webinars, they do podcasts, but they also do written documents that are really all areas of forensic science, but they do focus a lot on medical legal death investigation. And here, very nice, easy to use search button at the top, and you can put in any MDI topic in there, and it'll bring out all the products that are based on that topic. So if you put in time since death, you'll get the webinars, you'll get the podcasts, you'll get the documents, all specific to that topic. And just to give you some of the ideas, so the training webinars, they run the span of just being 1 hour to being a full day to being multiple days. So it can go into all different depths of training. And I think that these are, I think, as practitioners, these are good for us to learn and an easy way to keep up to the research as it's coming through. But I think it's also important to consider as medical examiner and coroner offices, as we move towards accreditation and you need to develop your training programs. Your new a really nice component that you can add to your training documents. So the webinars, also, so written documents. RTI has put together a lot. They've really done in-depth as well as sort of in brief looks at different areas within forensic science. So an in brief will be a document that runs 1 to 2 pages, really highlighting maybe a new technology that 1 or 2 law enforcement agencies have put into practice, sort of the success, some of the obstacles that they've come with adopting new technologies. So really kind of an easy, not too much of a lift, to just read through quickly and get an idea of what others are doing in the field. And then on the other end of the spectrum are landscape articles that are doing in-depth looks at new technology and how it's being implemented throughout the country. Most recently, there's a publication on the use of photography in sexual assault examinations. Now, as MDIs, we still do sexual assault examinations just in the morgue as opposed to the emergency room. But it really wanted to looking at what type of photography can help us, what kind of cameras are available. If you choose this camera, what kind of training are you looking at to get this camera up and implemented in your office? So rather all these different cameras through all these different manufacturers and whatnot, you can go to this depending what never reinvent the wheel, just work off the work that someone else has already done. And I think this is, this center is excellent at providing that service. And then the podcasts, they're interesting, they're quick. When I worked in Houston, when we had to go to a crime scene, Houston is Harris County is Texas. It's huge, right? So Houston, 4 million people. We had a lot of traffic. I would go to a crime scene where I'm sitting in my car at least an hour, right? I got to DC, they were all like, oh, it's so trafficy, it takes so long. DC is 10 miles by 10 miles and like 700. I'm like, come on, people, really? Regardless, you have to go to a crime scene, pop on a podcast and learn something new while we're traveling out to respond to that death or whatever, really interesting stuff, all different areas. And a great part that what RTI has done is they've done the research, but then they go to the experts. So the podcast is not RTI telling you something, it's an expert that's actually doing the work in the field, being interviewed and talking about their experiences, what they've learned. And so it's very, again, easy to consume and learn in a very pleasant way. So if you go to the website, you can subscribe as well, and you'll get a regular update of what's coming down the pike. But you can also look at the calendar of events, click on one and register, and then you'll get a meeting invitation, and then you can just attend. Or any of these events are archived. So either you can attend it live, which live means most of them are virtual. So you're going to have a pre-recorded presentation, and then a live virtual Q&A with the presenter. So your questions, you can ask your questions, you'll get the answers, you can hear other people ask questions, but all of that is also recorded and archived. So if you don't have that time during that day, you will be able to get it later, as well as work it into your training program. So for your new investigators coming on, they can also use it. But there is a calendar on the website, so you can see what's coming up and you can register what you want to attend. And I just kicked it to
Oh,
Lucas.
you pulled it out of the, yeah, just push it back in. Turn around. Just push it there.
Oh, here. Okay, I see. Sorry.
I'm not having it. Oh, there you go.
There, okay. Okay. From the bottom?
Just try clicking on the.
Okay, so the next one was just my email, which is very easy. Jennifer, JENNIFER .love, LOVE, @USDOJ.gov. So, okay. So if you have any questions, we all have time, have a few minutes for additional questions, but yeah. Thank you so much.
We have about 8 minutes, so if the four of you want to come up to the three of you, sorry. Three, you wanna come to the front. If there are any other questions? And so I'll start just to get their brain juices going. So when we think about a medical examiner's office, especially one that might be in a rural county that's really busy, or maybe a medical examiner that's covering 4 or 5 counties, et cetera, and they're interested in one of these grant programs, is there any assistance to help them apply for the programs, or, grant writing assistance that are that's available from NIJ or BJA or wherever? Because I think that's what I hear mostly. You were talking about how there's not very many represented. I think one of the barriers is they don't have enough time to do it, right? And if they got the grant, they can hire more people and they can write more grants. So what are you thinking about for helping them with that aspect of it, of actually writing?
So we have to check. We used to actually have like a document online that would kind of help out in terms of how to write a successful grant. I don't know if they did that this past year or not, but like one of the things that we did was, I mentioned like the successful applications. That's like one of the reasons we did that, because we would hear from people about, hey, can you provide us with resources to kind of help us out? So that's like why we provide like the successful application. So as I mentioned, there's like a couple of examples of those from the programs I mentioned. The other thing too is that one of the things, not for specifically for the programs I mentioned, but like in a broader base, we do have like micro grants. And so one of the ways that the micro grants help is that there might be an entity who could apply for the grant on behalf of maybe some rural jurisdictions who don't have the capabilities. And so what will happen is that one entity will receive, say, like, I don't know, $1 million. This ends an example. And then what they do is they're writing that grant application on behalf of these other entities. So when they receive the grant, they do all the federal, bureaucratic reporting, et cetera, but then they actually make subawards to like the rural jurisdiction to kind of help them out. So that's like one of the things we do. We actually had a micro grant component for the strengthening medical examiner for the system program, I think, but we didn't have any takers for that. But those are like 2 methods: successful application examples online, and then micro grants. So you'll see that, for example, our body worn camera program is pretty large. There's a micro grant entity for that to kind of help out in rural jurisdictions.
And if someone is interested in being part of a micro grant, how would they go about doing that?
I think they would have to like look online for that specific program. For like, for example, the body worn camera program. I don't know. I don't manage that program, so I don't know like all the intricate details of that. But I'll have some cards. If you guys have that question, just come up to me afterwards. I'll give you a card and I'll research that for you.
Yeah, so for NIJ, Thurston also mentioned this, we do have examples of research applications online. I mean, some of them are in like, DNA analysis. So if you're an NDI investigator, you'd be like, what the heck am I looking at here? I don't understand it. But we try to get a number of disciplined examples for research applications online so people can kind of see the redacted like Thurston has. So they're a little bit easier to understand. So that's one thing. 2, I think reaching out to your state administrative agency, well, whatever that is, right? Whether it's a separate component or another law enforcement agency, somebody's got a grant writer in there that's writing these things. So maybe getting their input on whatever you're trying to compose, if you're going independently, can also be kind of a resource. I will say that DOJ kind of shies away from, training people how to like apply for competitive grants, because whatever resource we have to have available has to be available to everybody, right? So we can't quite just step out and say, hey, we're gonna give this particular group help or this not group help. And it's a real barrier because we know that practitioners, especially under-resourced coroners and medical examiners and forensic labs, they don't have the staff, they don't have the time, they got a backlog of cases, it's very difficult to get involved, very difficult to take that extra step and make that effort to maybe not, get awarded a competitive award, whether it's capacity, or research. So the other example might be you may have somebody in the office who's done grants as an academic. Maybe they got their PhD and have done research in the past. Can they look at something you're writing? Do they have experience in writing for an award that they got? So also, if you're a medical examiner in a coroner, are there other systems that may be willing to share the information that they submitted if they were successful? So if it's possible, if you know someone who was successful in a fellowship program, clearly there's competition happening there for a single pot of money, right? So they may not be willing to share, but maybe they can only handle a couple fellows. Maybe they can only handle one fellow. They only have so much time. So maybe you can handle a fellow. How did they develop their fellowship program? How did they get involved in the grant writing project? What was their unique path to that success? So there's resources there and sharing of resources that I think can help be successful. And I think that's helpful. I think OGP does have online resources, but again, that's a self-starter type of machine to kind of help you with that. And I do know people who've become very successful in forensic science, applying for grants. But the experience that they've gained has often been taking courses in grant writing, reading up online, things that, real self-starter. So there is an investment, I think, that an organization has to make in order to be successful. There's no easy to, but the capacity grants, I don't know, the litmus on those, if they're not competitive, if they're, and you could maybe speak to this, if they're formula grants, I think the litmus is a little easier. So sometimes it's just a way to access that state funding stream. It might be just a conversation. They may not know how to spend the money. I mean, I got an HCMA grant back when I was in the DC government because they had extra money that they didn't know how to get rid of. And I needed a piece of equipment and I had an idea that applied. Department of Transportation was the same way. I was a toxicologist. We were looking for specific drugs. We needed equipment to do that. No problem. Here you go. It wasn't easy. I still had to write stuff up and justify it, but it was helpful, so.
And one other caveat to that. So I mentioned our missing and unidentified human remains program. So that third purpose area is for services to assist small, rural, and tribal jurisdictions. So we're making one award for that, for an entity that can do that on a national level, is for $1 million. So I mentioned we got that award last year. So the reason, the justification behind that was because we realized that like small, rural, and tribal, they don't have the capacity and the resources to necessarily do that. So that entity is going to address those needs on behalf of them. Sounds like one example of what we kind of did that.
Yep.
Right, are those SAAs that you talked about, are those published anywhere so we would know who to contact on a local level?
Yes, exactly. So if you go on our website, I'll give you my card, send me an email if you can, like, but on the BJA website, it will have like the SAAs for each state. You'll have like the entity name, the address, the phone number, all that stuff. And so that's specific, like, to the JAG program, but yeah, all that stuff online. So you can go on and check that out.
Okay, great. And then just one more quick question. For Coverdale or for the strengthening the medical examiner in the corners, could you use either one of those opportunities to apply for ACGME accreditation, or is it limited to name and IACME?
So what you just, that is actually listed in our solicitation for the NDC program. So there is an accreditation purpose area. So that is to apply and maintain accreditation. So yeah, you could do that. Just go and take a look. And like I said, there's an example of a successful application online from Western Michigan University for the accreditation purpose area. So go online and check that out. Otherwise, give me a call, send me an email, happy to help you out.
Thank you guys so much. Really appreciate it.